Welcome everyone. My name is Yu Shin, research staff at Urban at KAIST, which is a KAIST initiative on urban science. As always, the talk will span around 20 to 30 minutes and 10 to 15 minutes for Q&A. And you can always use the chat box to upload your questions during any time of the talk. Today, I'm really happy to introduce Professor Lisa Lim. Professor Lim teaches in the Civil and Environmental Engineering at KAIST. Her research focuses on improving health and well-being through design. She studies the relationship between city design and the society and try to provide better space to users. Please welcome Professor Lisa Lim.
Thank you for the great introduction. I'll start sharing my screen. Okay. Hi, everyone. It is a great pleasure to be here and to share my work with you all and talking about how the design of the cities and buildings can improve the health of individuals, which is the goal of our work in our lab. So as introduced by Dr. Shin, my name is Lisa Lim, and I am in Civil and Environmental Engineering at KAIST. And many of you might wonder how the design of the cities and buildings can improve health. So let's start with the definition of the health first. So health, according to WHO, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So we are not trying to cure the disease through the design of the cities or built environments, but we're trying to improve all the individuals' physical and mental health and their well-being as well. So I would like to introduce some of the studies in this field that actually shows how cities and buildings can improve our health. And I think many of you might know the benefit of the nature already. So access to nature were proven to be really beneficial for our physical and mental health. And probably the first study that actually highlighted that importance of the nature was published in 1984 by Roger Ulrich. So which is the first study listed in on the slide. So what he found out was that for the patients who's trying to recover after surgery in the hospitals, Roger actually compared two groups of the patients in the hospital room with the view to the nature, and patients in the hospital with the view to the brick wall. And what he found out was that patients who had access to the nature used less painkiller while they're recovering from the surgery. And he thought that the view through a window may actually influence recovery from surgery. And a lot of studies actually followed this study talking about how the access to nature can improve our health, our mood and our feelings, but also for students, learning experiences, and also for the employees, their satisfaction, job satisfaction as well. So it seems like there a chat. Oh, okay, that was an announcement. Thank you. So, and following up, another interesting study is that, as you might know already, the mixed land use can actually improve our physical activity. Relatively, in my perspective, South Korea is most of the cities in South Korea is using mixed land use. In other words, we can walk to the schools and we can walk to the grocery stores. And this kind of mixed land use were found to be like encourage more physical activity. As I just said, people can walk to buy certain things to the grocery stores or some of malls or coffee shops rather than using their cars to buy things or to commute or to go to the schools. And this is because but in some cities, especially in the United States, you need to use the car to buy very simple stuff from the grocery stores, or you need to actually go to the school by driving. But this kind of mixed land use, which allows us to do multiple different activities through different programs located in the cities, can encourage us to walk more during our daily life. And not just the urban scale, but also in terms of the design of the buildings, there are some of the elements that can actually improve our physical activity as well. The first interesting aspect of that is the location of the stairs. So a lot of studies actually found out that depending on where you locate the stairs, that can actually encourage people to use stairs rather than using elevators. For instance, if people can actually see the location of the stair when they enter the building, and before actually seeing the elevator, they're more likely to use the stairs. And using stairs can actually improve our physical activity and our health. So there are some of the studies that actually show how the design of the buildings or cities can improve our health. Most of the time, physical activity, so which can in turn can improve our health. But I would like to introduce one of my favorite studies that actually talks about how the layout of the building can also improve our health in a different perspective. So this is an image of an inpatient room in a hospital where patients are trying to recover after the surgery. And this one of the study, which I just said that I'm going to introduce, was conducted by a colleague of mine at Georgia Tech. And she used to be a healthcare professional in hospitals. And what she found out while working in the hospital was that something about the layout of the hospital was she and her colleagues thought something about the layout of the hospital were actually affecting the mortality rates of the patients. So what she found out by actually conducting a further study was that in ICU rooms, intensive care units, she compared the visibility level of all the ICU rooms in different hospitals. And what she found out was that for the rooms that have low visibility to the patient beds from the location of the nurse stations or the corridors where nurses or healthcare providers use to actually monitor the patients, it was found out that high visibility rooms reduce odds of death by 42%. In other words, if the visibility were low, visibility to the patient beds were low, they were more likely to die, which is very sad. But in other perspective, if we think from another perspective, this actually means design can even save lives. So this is a strong statement saying that how the design of the buildings and actually and the cities cannot just improve our physical activity, but also even save lives through the design of the layouts as well. So that's what we're trying to do in our lab, which is called as Health Design Lab. We're trying to improve health and well-being through design. And this is because whether we are aware of it or not, we are interacting with our physical environment. Most of the time, if we are in the indoors, we are actually interacting with some of the furniture or walls or the windows, all those the locations of the windows, walls that affect our behaviors, our views, what we see, how we behave. So using those as a tool, we're trying to improve our physical and mental health and improve our well-being as well. So some of the research projects that we're conducting in our lab are listed on the slide. So they are actually focusing on how to improve health and also improve the safety of the residents as well. So for instance, we're trying to analyze the relationships between the urban fire accidents and the attributes of the buildings and urban characteristics, how those are related in a way to prevent most of the time the casualty of urban fire accidents through the design of the cities and buildings. And main population that we're targeting to investigate so we could help through the design of the buildings and cities is the elderly population. So as you might know already, our society and our world is aging, and a lot of needs are happening especially for the aging population. So we're trying to encourage physical activities of older adults through the design of walkable streets. And another important activity that we're trying to encourage is the leisure activities. Two main important behaviors, in my perspective, that we're trying to encourage through the design of the cities and the buildings are walking and playing. So we are trying to promote the participation of the leisure activities through the design of the laser facilities for the older adults. And we're trying to prevent fall accidents, which is really dangerous for all the older adults, including us as well, in the urban scale and also in the home, inside the home environment as well. And another population that we are trying to help through the design of the buildings is the healthcare professionals. As you might know already, a lot of healthcare professionals are suffering from burnout, especially after the COVID. So we are trying to figure out the design elements that affect mental health, especially their stress and burnout, and trying to reduce their stress and burnout through the design of the hospitals. And today I'm going to explain more about our second project, encouraging physical activities of all older adults through the design of the walkable streets. So as I just said, our world is aging, not just South Korea, but worldwide. By 2030, 1 in 6 people in the world will be aged 60 years or over, which is a surprising number. And according to WHO, built environments, especially the outdoor spaces and buildings, along with the housing for the older adults, are an important key factors of the age-friendly cities. And you might wonder why the cities design of the city is so important for the older adults compared to younger adults. Is that because walking is a major transportation for the elderly, and because of their conditions, physical conditions and health conditions, they are more susceptible to some challenging environments. For instance, just one staircase or sometimes very high-rise staircase might be easy to overcome for kids, children, or for younger adults, but just one step can be a very big challenge for the older adults. And sometimes people, older adults might fall out of that just one step, and that could result very sad outcome as well. So we are trying to improve the health of the older adults through the design of the cities, but in this case, the walking activities through the design of the streets. So the main question that we're trying to tackle is how can we provide more walkable streets and improve their physical activity? And in order to, as a way to answer this question, as a one way to answer this question, I'm going to introduce this paper, which was recently published, titled as Sustainable Walkable Cities for the Elderly, Identification of the Built Environment for Walkability by Activity Purpose. So what this paper is trying to answer is this question. So this is an image of the screenshot that I captured by entering walkable streets on Google. And we enter walkable streets. There's so many different images that actually appear, which is really very important and interesting and worth looking at more closely. But then the question is, would the walkable streets for older adults be the same? And furthering that, with the walkable streets for older adults, especially walking for different purposes, would be the same. In other words, just to unpack that question a little bit more, what we're trying to investigate was probably the walkable streets for the older adults, especially according to their walking purpose, we might need to think differently. So for instance, walking to going out from the home and walking the environment, the city for leisure, or like for instance, visiting the parks near their houses, or going to the mountains might be different from walking to go to the grocery store, or walking to get to the convenience store, or go to the pharmacy, especially during the COVID. So that's what we thought, and we wanted to compare would the walking patterns of older adults differ by the walking purpose. First, we look at the walking pattern itself, and then we try to investigate their preferred walking environments according to their walking purpose as well. So what we did was we actually used this GPS data and their trip diary, which was collected in 2020 from July to August. And the data was provided by a National Research Institute in South Korea called Architecture and Urban Research Institute, in short, AURI. And this data contained around 117K GPS points, which is worth 160 day-person data. And this data, we use the data in this Ujeongbu city in Gyeonggi-do province in South Korea. So what we did first, we categorized their walking routes according to their destinations. So we differentiated leisure walking routes and commercial walking and social walking according to their destinations. And the destinations for the leisure walking includes locations like park, rivers, and for commercial walking destinations include supermarket, store, bank, real estate, hospital, and pharmacy. And for social walking destination, those include church, restaurant, and neighborhoods and coffee shops. And when we plot all their routes going to these different destinations, as you can see here, their routes seem to be a little bit different, right? LE group stands for leisure group, and CO group stands for commercial group, and SO group stands for social group. And the pathway or the length of those lines, colored lines, seem to be a little bit different. So when we compare that statistically, what we found out was that people going to those leisure-related destinations walked longer and further and walked larger area. And the older adults going to those commercial walking destinations walked shortest distance. And the older adults walking for social walked faster according to their speed of the GPS data. So what we found out was that, yes, according to their walking purpose, their walking patterns were different. So their speed or the length or the time, the area that they walked were different according to their walking purpose itself. So then the important question that we are trying to answer is, then what about their preferred streets? What about the physical environments that they walked? So in order to investigate their physical environments for the different walking purposes, we developed three different models for leisure walking, for commercial walking, and for social walking using random forest. So the main three different categories of variables include the built environment characteristics, individual characteristics, and their path preference. So we're trying to see how the built environment characteristics and individual characteristics can predict the path they choose for walking for leisure and walking for commercial and walking for social. So just to unpack those physical environment factors a little bit more, I think there's a question in the chat box whether they can ask a question during the seminar.
Yeah, for using the mic, you can only answer the question after the seminar. Thank you,
After
Professor
the
Lin.
seminar.
Yeah, I will answer to those like chat box
Great.
questions.
Thank you.
Thank you.
So just to unpack those independent variables a little bit more, there are 4 different categories of the variables under built environment characteristics and various features under individual characteristics, most of the time demographic features of the individuals. So the main 4 categories are coming from the literature review. Previous studies have found out greenness, the nature is really important for the walking experiences. And as I just explained when I started the lecture, the mixed land use and the diversity of the programs are important for encouraging the walking experiences. And the street network seem to be important, especially the syntactic of the street networks is important for the walking experience as well. So just to go one by one, the walking street pleasure category includes 3 different variables, which is greenness, nature, and building ear. So building ear is literally, it's talking about how old the buildings are. And the greenness and nature are actually capturing the amount of the nature and the green stuff from the perspective of the streets for the greenness and from the perspective of the entire area for the nature. So more detailed information about each variable is explained in the paper, which you should be able to access online. And the walking street enclosure includes the floor area ratio and the building height and the number of buildings along the path that they walked. So what we did, as you can see here in this figure, we actually captured all the pathway and calculated the floor area ratio and building height and the building number of the buildings for the alongside the streets that all the individuals walked for each route. And for the walking street diversity, what we calculated was that we calculate the ratio of residential buildings, public buildings, and commercial buildings and industrial buildings, and calculated the diversity aspect of those different programs alongside their pathway. And the last category, which is about walking street network. So we calculated road integration and road connectivity of this entire city using space syntax approach and the tool that's called LeftMap. And just to briefly explain, the road integration actually explains how well each road segment is integrated in the entire system. In other words, how easy it is for people to access from each street to all other streets according to the syntactic of the street network. And road connectivity explains how many roads are how many road segments are connected from each segment, and the road width is literally the width of the road. If there are people who are interested to learn more about this road integration or road connectivity regarding this space syntax, here I include a website as a reference where you can find much more information about the space syntax online as well. So, and as I explained, our target variable or our dependent variable was the choice of the path. So what we compared was the chosen path compared to the shortest path according to our assumption, and many others' assumption that people would choose shortest path to get from one point to another point. So the shortest path is plausible path that they might choose, but despite there is a shortest path, people, especially the older adults, selected another path to get to one point to another point. So we tried to compare the characteristics between the shortest path that weren't chosen and the chosen path that were chosen by the older adults. So just to sum up, the random forest model includes these three different categories of the variables: the built environment characteristics and individual characteristics and path preferences for each model. And more importantly, what we wanted to see, as I explained, was what are the important built environment factors that are associated with their walking path. And interestingly, when we conducted feature importance, the important features for each model were different. In other words, the important features for leisure walking and for commercial walking and social walking, they were different. And just to briefly say, the all three models reported like more than 80% of accuracy, and more information is included in the paper. So just to recap, the important built environment features were different by the walking purpose. So just to look at this more closely, first, there were 4 different categories: the walking street pleasure, walking street enclosure, walking street diversity, and walking street network that were included in the built environment characteristics. And first, the important categories were different. For leisure walking, walking street pleasure and walking street network seem to be more important compared to the other two, while for commercial and social walking, enclosure and diversity categories were found to be more important to compare to the other two. So looking at those features more closely, so for leisure walking, greenness, the ratio of the nature, and road connectivity and road integration were found to be more important, while for commercial walking, the commercial ratio, building height, floor area ratio, and residential area ratio were found to be important. And for social walking, public facilities ratio, road connectivity, and building height and number of buildings were found to be more important for each model. Those are the top 4 that I highlighted. And we conducted PDP plot to see how that's related to each other. So, and these are the 4 PDP plots that were found to be important for the leisure walking. So as you can see here on the slide, the red colored graph indicates the negative relationship, while the blue one indicates the positive relationship. So road connectivity and road integration, which are two main variables that actually represent the network of the streets, were found to be negatively associated with the walking path choice, and especially starting the value 2.3 for road connectivity, it decreases significantly. And what this is indicating is that the older adults walked the streets that was less for while walking for leisure. The path that they chose for walking for leisure was negatively associated with road connectivity and road integration, which means they walked less complex streets. In late explanation, in late term, less complex streets. In other words, they avoided intersections, and they preferred using less integrated streets for leisure walking. And for greatness in nature, as we expected, if there were more streets they chose were reported had more green and nature ratios, which it reported the positive relationship as well. And if we look at the commercial walking, interestingly, as I said, the important features were different, especially commercial ratio and two variables related to the buildings, which is the floor area ratio and the building height. Those three reported the positive relationship, while the residential ratio reported the negative relationship as well. So and the commercial ratio is about 20% or more, there is a positive relationship with walking. And the commercial buildings include restaurants, markets, alongside the path. And lastly, the social walking. And as I just said, the four features were different from the commercial walking and also from the leisure walking. Positive building ratio and the building height and building number were found to be have positive relation with the social walking, while the road connectivity reported negative relationship with the social walking. So just to summarize all this, so what we can say with this is the important walking environments of the routes chosen by the elderly are different for each walking group, and non-linear relationships were shown. This result and the findings could be used for the policy recommendations, but to summarize briefly, so for leisure walking, so the green spaces seem to be important. So providing green spaces might be good, and also parks and considering the low connectivity roads, especially alongside the parks and rivers where they prefer to walk for their leisure, might be good to increase their walking experiences, and especially for leisure. And for commercial walking, the ratio of the commercial buildings and the height of the buildings seem to work importantly. And for social walking, the ratio of public facilities and especially along with low connectivity roads might be good to increase their walking experiences. And I think all of this is really important to understand how the built environments can support older adults walking in order to create age-friendly walkable cities that can maintain the physical activity of older adults. And this is saying, not saying our study is important and this is what everybody needs to use. That's not what I'm trying to say. But our study is going to add one more evidence and provide one more insight to providing age-friendly cities, which can actually improve the health of older adults. And that's what we hope for, and that's why we are doing this study. And sharing this perspective, I would like to introduce this study and this project, which is done in Simon Fraser University in Canada. And they're also looking at how to create cities, especially for dementia-inclusive streets and community access, participation, and engagement. And I am bringing this project to show this short video clip, which has really strong statement at the end, which aligns what I just said. what we're doing right now that might not help me or it might not help you, but hopefully it will help somebody else in the future. So I'll conclude my lecture by looking at this video clip together. Which should work momentarily.
Awesome. So we will walk both of us first, and then both of them will follow. Right on.
Because of my disease, I'm not able to drive. I like to get out in the fresh air. I think that that's important for my health and well-being, getting the blood pumping to my brain.
I get lost 2 times already. So I'm worried I get worse, later. So
at this corner here, where do you go or how do you get back to your place from here?
Straight along here.
So you walk along the grass here.
Oh yeah. No matter where you go in North America, it is geared to driving. It is not geared to walking. The only thing I can really say about this whole scenario, it might not help me, it might not help her, but hopefully it will help somebody else.
Okay. And that concludes my lecture. Thank you.
Thank you, Professor Lin, for the great talk. And I believe we have some questions from the audience. And during the talk, Il-Yung Jung has asked about maybe if he could ask a question in mic. Could you ask a question to her?
Okay, thank you, Professor, for a wonderful presentation. It was really impressive and cool findings. I'm a student from business and technology management, but I'm also interested in this, how to make a better cities with the design. So I joined this talk. I have a question about the data that you analyzed. So you said you got a GPS data and the trip diaries. Could you explain more about it? I wonder how you could know about the destination of people's, or is it collected by the government, or is it elder people using applications or something?
Yes. So first of all, thank you for coming to the lecture, and I thank you for your interest regarding the creating better environments for the individuals. And just to answer your question, this GPS data was collected by a national research institute called Architecture and Urban Research Institute, in Korean, 건축공간연구원, in short, AURI. And this is a national research institute working for the government, trying to provide better architecture and better cities for all the individuals in South Korea. So if you're asking if this was collected by the government, in a sense, yes. And they this was using an application, an app. So they were asked, all the individuals who were participating in this data collection were asked to use the app while going out, but also they were asked to write down where they're trying to go and also when they're leaving. So that's it. That was recording the trip diary. And it seems like there is also a question regarding the age differentiation in the chat box, and I'll explain this along with this data. So this data was collected, especially for this city. There were 32 participants who participated in this study, and they collected the data for about a week, which varies according to the individuals. And a total, it's worth 160-day% data. And the participants participating in the study were all older adults. I don't quite remember whether it was 60 or 65, but they were above certain age. And it would be interesting to look at the differentiation between the age groups after like 60 to 65, 65 to 7 or 70 or 70 above 70. But considering the limited number of participants, it might be hard to differentiate their behaviors. But if there are another set of data, so if we can like further this study and collect data from like thousands of individuals using their GPS data, or collect using already collected data through their phones or some other applications, that's something that would be interesting to consider, along with their walking status and their physical conditions as well.
Okay, thank you. Could I ask one more question?
Sure.
So this is about older people with
Yes.
the more, older than age 60 or something, but are you expecting the result to be different when you test this with young adults or maybe
Very good
children?
question. Very good question. One of the reasons why I've thought this study was really interesting is because that actually reported a little bit different result. So let me use this image here, which actually represents the road integration of the city. So space syntax is a field of study that actually investigates how the syntactic aspect of the cities and the buildings affect the behaviors of individuals or perception of the individuals as well. And space syntax has this field of space syntax has all different tools and metrics that measure and quantify the physical environments. And this metric that we're using, the road integration, is one of the many variables that's been studied a lot in this field. And just to recap what I explained during the lecture, the road integration represents how easy people can access other streets or other points, depending on the unit that we use for the analysis. It could be points, segments, axial lines, convex, different types of things. How easy it is to access all other units within the system from each unit. In other words, so if you are located in this reddish colored streets, it's easy to access all other streets within the system, within the city. And previously, a lot of studies have found that there are more people walking by or cars in those well-integrated streets. And it's kind of intuitive. It's easy to access all other streets within the system. So since it's easy to access all other streets, more people are expected to be there, and it was found to be the case as well. So in well-integrated streets, more people were found. So like more people use those well-integrated streets. But in case of the older adults, it was the opposite. The streets that they used, especially for the leisure. Let's look at the leisure. Leisure walking. So it actually reported the negative relationship here. So especially for the older adults, the streets they choose were less integrated, which is kind of opposite from the previous study. Well-integrated streets will be used or be chosen more for walking, especially for walking. So, but this is understandable, thinking from the elderly's perspective, and which was not tested in the study, but some other studies have found that older adults experience lots of especially older pedestrian, experience lots of car accidents alongside the crosswalk and at intersections. And they might try to avoid those intersections or well-integrated streets, especially for walking for leisure and for other purposes as well. So just to explain this road connectivity a little bit more, this is using a road segment as a unit. So if the value is 2, it means one street. So each segment has 2 points that's connected with another road segment. So if the value is 2, it's one street. So starting around 0.23, it reduces dramatically, which means if there are, they tend to avoid the intersection where the road connectivity is higher than 3.
Thank you for the answer.
Sure. Are there any other questions? Seems like something on the chat box.
Yeah, there are some questions. So thank you for the answering my question. And the second question is from Jung-hee Kim. Are there common important elements for commercial, leisure, and social purposes? And if so, what is it?
Yes, thank you for the question. And if we look at this data, so we are just looking at some top important features, especially the top 4, top 5 of them. But there are the top 4 that's been selected are a little bit different. So there is no one feature that goes across all 3 different leisure purposes, walking purposes. But there are some features that seem to be important, relatively important for most of them. For instance, like the ones in this middle, which is building height, or like this RC road connectivity. So like it was top 5 for this one, or top 1 and top 2. So road connectivity, again, how many roads are connected to each road segment. But in terms of the top 4, no one feature scored the best for all 3 models. But just to add, so for further explanation about this is that we are not trying to differentiate the street for leisure, the street for commercial, the street for social. I think it's better and it's the best if one street can perform well for all different purposes. But if we have to allocate our resource efficiently, probably we can identify some important features first and try to accommodate those important features, especially for the areas where more of the leisure walkings are happening, or especially for the areas where more commercial or social activities are happening. But I think it would be the best if we can provide the streets that could be used for, that could be suitable for different purposes as well. And probably can go to the next question.
Yep, thank you. And the next question is quite long. And firstly, thank you, Professor, for the interesting session today. I have a few questions and curious about your opinions regarding them. The first one is, as mentioned, I agree that urban planning plays an important role in our well-being. However, given that most cities in a number of countries, for example, in South Korea, has already been majorly developed, I am curious on how realistic are these data obtained, be able to improve the urban design of cities that are already well developed, like, for example, maybe in terms of cost, public response, and time required, etc.
Great, thank you for the question. This is an interesting question. So yes, I agree many cities in South Korea are well developed, but still, there are a lot of rooms for improvements, especially for accommodating the older adults and the health of the individuals. So when we are saying improvements and developing the cities, probably something that we're not imagining is like deconstructing everything and reconstructing the new city. What we're trying to do is evaluating the current condition of the cities and identify the ones that needs further improvements. And what this kind of study can actually help doing is using this important features as criteria. We can evaluate the conditions of existing streets and identify the street that might need some further investments or some refinements, especially to connect safe walking experiences for leisure. For instance, like certain parts of the city might have streets that's suitable for walking, and certain parts of the city might have streets that's suitable for walking, but there could be a gap in between. Then we can use this kind of data to evaluate and identify those locations and try to make the connection throughout. So people who's trying to walk in a safe way, we can actually provide some safer environments to them. And I guess we can go to the next question, which is about the cities that's well designed for the elderly in South Korea, in my perspective. I think that's an interesting question, but I didn't have a chance to think about that in that perspective. But what I can say is that I think a lot of cities in South Korea are trying a lot to provide more age-friendly cities, and I admire those attempts and efforts, and I hope that can actually translate into the better physical environments for the older adults.
Thank you for
And,
the answering. And we have, I believe this is the last question from Dr. Park. It was very impressive that your study looked at the walking behavior of the population with certain conditions, such as age and disease status. And this type of sample research based on such personal information has the disadvantage that it is difficult to increase the size of the sample. So can you introduce any ideas, experiences for increasing the number of participants or generalizing based on this?
That's a really interesting question. I think, yes, as stated in the question, I think thinking about the spatial condition of certain population would be really important to be inclusive cities and buildings. So, and to allow all the people with different conditions and different situations and trying to improve their health through the design of the built environment is something that I am trying to do. And yes, it could be hard to gather a lot of data, but there are certain channels and routes to actually collect the data for the targeted population as well. So, but let me read that question again. So the question is, any ideas or experiences for increasing the amount of the participants or generalizing the results? So in terms of the increasing the amount of participants or the sample size is finding the right partner, in my perspective, that could be used to actually increase the sample size. So for instance, I am conducting some studies with healthcare systems. So, and they might have their own access to the certain population. And I can work with another partner that has access to another specific, that's actually interacting with another special population. Then working with them will give you the access to that data as well, as a way to increase the sample size. So I think working with the right partner who might have the access to that kind of data might be one way of doing it. But in terms of the generalizing the results, I'm not sure whether we need to generalize the results regarding the older adults to all individuals. I think one argument that I would like to share is that if we provide the built environments for the older adults, or if we make it inclusive for everybody, for that special population, it might be inclusive for everybody, if that makes sense. Are there any other questions?
I think that's all questions from the audience, and we are running out of the time exactly at the 50 minutes mark. So yeah, thank you for the great presentation today.
Okay. Thank you for joining the lecture today.
감사합니다.
감사합니다.